So on this day, I went to bed to sleep and I felt a dark presence hovering around the room, hovering around myself. All of a sudden, I felt this giant-like pressure on my chest that was not aiding me to breathe very well. I couldn't scream. I'm trying to move my body, but I couldn't. I felt paralyzed. I couldn't move any part of my body. But in my head, I could hear myself screaming, but physically, I couldn't hear myself scream for help. You know, my eyes were open, but all I could see was just something like a dark shadow, you know, just moving around the room very fast. And then when I could finally scream for help, everything came to like a pause. And there was this feeling of intense tiredness. My joints were weak. I was so scared. And I just felt very, very scared afterwards.
You might have heard the term sleep paralysis. There are chances that you have experienced it. Some describe the experience as being tortured by unseen forces. Some describe it as helplessly staring death in the face. But whatever the description might be, this is one of the scariest experiences you might face in your lifetime. Spiritual leaders describe it as some kind of demonic attack. Medicine explains that it is a psychological sleep disorder.
So medical will always have their interpretation to something. But I believe the underlying factor is that we have to understand first that we're a spirit before we're a man. So everything that happens to us first comes from our spirit, and it just gives life to our body. The first thing the devil will always attack when it comes to your life is your ability to speak. So once the devil can hold your speech, paralyze your speech, you are done.
The experience is terrific. You can't just imagine yourself being trapped in your body, you know, by unknown forces while making an attempt to move. So within your mind and your subconsciousness, you have this urge to move, but your body is saying you cannot move. You may want to scream, yet you cannot scream. So it comes with fear, it comes with panic, it comes with some sort of frustration that one thinks that it's just going to be the end of life, but it is usually not, because it lasts just for a few moments and the person recovers.
Look at this. This video was recorded live on the thermal imaging camera. On top of the sleeping individual is a mysterious creature climbing on top of him and seemingly strangling him. What do you think? Could this be proof that demons are the cause of sleep paralysis?
As far back as 2000 BC, you know, some medical texts and historic books have made reference to night demons, you know, suppressing people while asleep, trying to kill them, or something like that. And you know, some books written in the Mesopotamia region, up to the Roman empires, you find things like that. Up to the 16th to 18th century, people still refer to them as demonic, you know, some evil spirits, some forces trying to suppress individuals while sleeping. You can think about the incubus, you know, or the incubus, which is referred to some form of terrific looking creature, you know, like an alien creature, which comes in the night and then sits on the chest of individuals that are asleep and suppresses them.
In 1781, Swiss artist Henry Fuseli painted a painting of a woman deep in sleep, and on her chest sat a demonic ape-like incubus. He titled this painting The Nightmare. The painting depicts the effect of this experience on the woman, who lay helpless, motionless, and lifeless while the creature suppresses her. This position is believed by medical personnel to encourage nightmares. Interestingly, the word nightmare is derived from Mara, a Scandinavian mythological term referring to a spirit sent to torment or suffocate sleepers. Suffocation is also a common symptom of sleep paralysis. Though medicine and religion agree on common symptoms associated with sleep paralysis, medicine does not quite agree that sleep paralysis is caused by demons.
There are two types of sleep. We have REM sleep and the non-REM sleep, okay? Now the REM sleep, REM is just rapid eye movement, and the non-REM sleep is the non-rapid eye movement sleep. Now the REM sleep is the first type of sleep before you go into deeper sleep, which is the non-REM sleep, okay? And it's REM sleep is still the kind of sleep that you have just before waking up, okay? And during REM sleep, there's what we call muscle atonia, meaning paralysis, sort of, okay? And what usually happens is in sleep paralysis is that there's a disconnection between, because you're supposed to wake up all at once. Everything is supposed to wake up at once, so to speak. I'm making it later now. However, in sleep paralysis, a person gains consciousness before the muscle tone comes back, before the paralysis wanes off, the natural paralysis of sleep. Because when we sleep, we lay down, we can't move.
Finding, identifying, and tackling the underlying conditions, that are responsible for this sleep paralysis will help in the management of sleep paralysis. So let me recap. Sleep disorders, commonly narcolepsy, type 1, type 2, fear, phobia, panic, anxiety, and then obstructive sleep apnea are some of the conditions that lead to that. People who are on certain stimulants, psychotropic drugs and things like that, and those who have suffered traumatic brain injury and post-traumatic stress disorder may also experience that. So once the underlying conditions are identified, they are managed. There are certain postures that trigger this. There's this position we call supine position, lying with the back and then the face up, like looking at the roof or the ceiling. That position has been adjudged to be more frequently associated with sleep paralysis.
We can explain the phenomenon, meaning this is what happens. But for somebody to pinpoint like this is the particular cause of sleep paralysis, medicine, well, the cause is unknown as of now. For treatment, I would say the treatment is not the direct treatment for the sleep paralysis itself. However, it's a treatment of the situation around it. Now, treatment can be anything from sleep hygiene, psychotherapy, and medication, depending on the cause, like I said. And now, for sleep hygiene, what we usually advocate is that, one, the person should maintain a normal 6 to 8 hours of sleep, go to bed at a particular time, wake up at a particular time, and make sure that this is the routine. Avoid coffee at night. Okay, just mild to moderate mild exercise before bed, not excessive exercise, and sleep in a room that is dark enough, and don't use the room for leisure activities like TV or radio. The sleep should be only for sleep. The bedroom should be only for sleeping. Okay, and yes, avoid alcoholic drinks and other psychoactive substances, especially close to bedtime. And what we call wind down before sleep. Have routine activities that you do that are supposed to induce sleep, like reading an old novel, or reading to the children and things like that.
The causes of sleep paralysis might remain debatable, but the experience is as real as day and night. The fear, the suffocation, the tales of victims seeing things, and sometimes these experiences might be life-threatening.
Sleep paralysis is real on 3 grounds. The first is that the experience of being paralyzed is true. The second is that the experience of being awake and the hallucinations that follow it are also what? True. But what is not true in that experience, as a third component, is the fact that certain aliens or demonic spirits are behind it.
Don't accept what they tell you based on their profession. Yes, they're well versed in that physically, but they're not well versed in it spiritually. So take the physical advice, but portray your spiritual light. Don't accept what they say to you.